Good morning to one and all. Today's lecture topic is on basic implantology. I'm Dr. Priyanka. So, at the end of the lecture, you will be able to classify the implants and its components, describe and recognize the importance of osseointegration. So, these are the learning objectives, outcomes. Coming to a dental implant. Okay, so a dental implant, this is a dental implant. So, a dental implant is an artificial dental root that is surgically inserted into the jawbone, and it can be used by the dentist as a platform for any prosthesis. Okay, so these are the gums, this is the bone, this is the implant. Okay, and all right, so let's come to the components of an dental implant. So here you can see the components. So we are going to start from down and go up. Okay, so first is the implant body or a fixture. So what that is the portion of implant placed inside the bone. Okay, so whatever you see inside the bone, that is known as a fixture. Okay, coming to the first stage, cover screw. So it is also known as a healing screw. It is a small screw which covers the fixture. Okay, so it covers the fixture, inner surface after placement of the fixture. Okay, coming to the second stage, perimucosal extension. So it extends the implant above the soft tissue. Okay, develops the premucosal perimucosal seal. Okay, so this extends above the implant. Okay, coming to the abutment. So these are the attachments where the implant is, it will seat. Okay, so abutment can be a screw, it can be from the cement, and also it can be an attachment. So these are the different examples of an attachment. Okay, abutment. Coming to a transfer coping. So transfer coping are precisely machined. Okay, sorry. This is the transfer coping. This is the indirect and this is the direct. So a transfer coping are precisely machined from titanium alloys and attached to the implant fixture by a titanium screw or a guide pin. Okay, it helps us in taking impression. Okay, so these are the transfer copings and you fix it in the implant fixture by help of a screw. So basically we take impressions by these. So we'll be learning the open and the close technique later. Yeah, okay. So coming to the analogs, so implant body and an abutment. So analog basically is a replica of an implant, abutment or attachment. So usually incorporated within the cast for prosthetic reconstruction. So again, this is for the reconstruction. Okay. So when we take out the transfer coping from our impression, we place the analog, that is the implant replica, inside. Okay, so used in the model to fabricate it in the prosthetic lab. Okay, abutments is fitted to the analog and prosthesis to be fabricated in the lab. Okay, so on this there are the abutment which will fit inside, and then it can help in forming the um, implant surface. Coming to the coping. So a coping is used to copy the exact shape and position of a dental implant abutment interface in the impression for accurate positioning of dental implant analog in the working model. Okay, so again for the impression purpose. Okay, so last component is the coping or prosthesis screw. It is used to fasten the prosthetic components together. Okay, so when you put it inside, it will fasten all the components together. Okay, so these were the components. Coming to osseointegration, so basically Brenmark was the one who coined the term. So, and the concept. So, Brent Mark in 1916 defined osseointegration as a direct structural and functional connection between bone and the surface of a load carrying implant. Okay, so it's basically the connection. So, this was an old concept which was there, and then came the osseointegration, okay, and then came the biointegration, all right, and then came the osseointegration, all right. So, what was fibro-osseous integration? It was when the soft tissue or the fiber interposed between the implant surface and the bone. Okay. Biointegration was implant is covered with bioactive material like hydroxyapatite. Okay. So osseointegration was a structural connection between the bone and the uh, load carrying implant. Okay. Okay, so you can see the difference between the two. Coming to the classification of dental implants. So it can be classified on different types on based on anchorage and also blade form and based on texture. So, firstly, based on the type of implant, so submucosal implants are there, subperiosteal implants are there, transosteal, and endosteel. Okay, so most commonly is the used is the endosteel. So coming to the subperiosteal is like the metal implant framework rests directly on top of the bone surface underlying periosteum and provides attachment post which extends through the gingival tissue for prosthetic anchorage. Okay, so we'll be seeing all the photos in the next slides. Coming to the transosteal, so it penetrates the entire thickness of the cortical plate or the bone, which is now not used at all. Okay, so coming to the blade form, these are the conventional blade designs and the vented. So we will see it in the photos in the next slides. Based on the texture, the surface with pure titanium. So before there were only pure titanium implants. Second is the acid edged. So they were acid edged, the titanium implants. Then the porous beaded surface and the hydroxyapatite coated. Okay, so these were the porous surface and these were the hydroxyapatite coated surface on the implant. Okay, so coming to the endosteel. Okay, so this is the one which is most commonly used. Okay, the endosteel type. Subperiosteal type, so it will rest above the bone. It will rest on the bone. Yeah. Here is the one which I was talking about. That is a transosteal, which is not used anymore. So it will pierce through the whole cortical plate. Okay. Yeah. There, transosteal implant. Okay. Examples of the vented design. So these are the blade designs, and this is the vented blade design. So you can see that there are two holes for better connection. Okay, coming to the according to the material or the texture. So this is a titanium, pure titanium dental implant. This is the acid edge. So titanium is present on top. It is acid edged, and this is the porous beaded type of implant. Okay, so coming to teeth versus implant. So what happens is in an implant there's lack of PDL. Implant cannot intrude or migrate. So there's a concept of proprioception, which basically means it means like a sensory process that act to program and monitor the motor responses. So Basically, who's responsible for this? It's the PDL. Okay, so PDL has multiple blood vessels, so it has myelinated and unmyelinated sensory nerves, fibers, and also proprioceptors. Okay, so these help in regulating the motor function. Okay, and implant is also contraindicated in a growing individual. This is because we once we are growing and advancing, we cannot put an implant as there are still changes which are going on in the bone surface and the height and the length and the width of the bone. So it is really not indicated till a person is reaches the growth spurts. Okay, so another difference is the overload or parafunctional habit, which causes microstain or microfracture in the bone. So, overloading the surfaces or any parafunctional habits, such as teeth grinding, can cause microfractures in the bone surface. Okay, coming to the indication for dental implants or implant treatment. So first is to restore the dental aesthetics, of course, for chewing and chewing, mastication, and speech. So these are the three basic functions, very basic. Okay, coming to space maintenance and occlusal stability. If you're giving an implant, definitely it's going to help us preserve the space. Okay, and then there's going to be an occlusal stability as well if all the occlusion is restored to normal. Coming to the orthodontic anchorage, so these are also known as like the orthodontic implants we are talking about. Okay, it's also known as like the mini screws. So it helps in giving the anchorage. Okay, in the ortho treatment. So these are not used for osseointegration. They're basically used for anchorage. Okay, and also indicated um, as it is um, um, so convenience and comfort is also one of the advantages of the dental implant. Okay, coming to the bone preservation. Sorry, the last point and the prevention of disuse atrophy after tooth loss. So after tooth loss, if you directly place the dental implant, we are helping the simulation of the underlying tissues, and that encourages a strong jaw, which prevents the resorption of the bone tissues. Okay, so we are trying to place an implant and the osseointegration will start, and definitely that's going to help reduce any of the bone loss which is going on. So it's going to help in the preservation of the. Okay, so coming to the materials used, uh, as you can see that commercially pure titanium has been used. So this is the example. Um, Now there is a mixture. So that is like a titanium implant with the zirconium abutment. It works really well. Okay, coming to the ceratop. So these are just the ceramic materials which is used, and it's basically full ceramic for implant and restoration. Okay, and implant. So yeah, so it's the whole thing. Okay, and titanium alloys are basically, it contains a mixture of titanium and other chemical elements. So there are four grades of these are the types, and example of this titanium alloy can be um, TI-6AL-4V. So these are like the common titanium alloys which are used. Okay, all right. Okay, coming to how long do implants basically last? So, survival rates of dental implants have been reported to be in excess of 90% after 15 years. Okay, so they still have a very good survival rate. So, the risk factors that affect the management of an implant case and its prognosis. So, coming to some specific systemic disease and local factors. So systemic disease, definitely uncontrollable diabetes, immunosuppression, and other medications such as bisphosphonates. Okay, so basically bisphosphonate uh, increases the risk of osteonecrosis of the jaw. Okay, so if we still place it in patients having bisphosphonates, so there is a risk of necrosis of the jaw. Okay, that's why it's um, in the systemic diseases risk factors. Yeah. Okay, so coming to the local factors, that is patient receiving radiotherapy, smoking, poor bone quality, density, periodontal diseases, occlusal trauma, parafunctional habits, bruxism, and endodontic. Okay, so um, if you want to have a good result, we should really avoid it in such cases. Otherwise, it's going to lead into infection, implant fracture, or loosening of the implant. Okay, or if we still do it, it can also lead to the periapical changes present. Okay, coming to the risk factors that affect the management of an implant case and its prognosis. So, periapical lesion in the adjacent teeth, okay, which is really unfavorable. So, smile line, unrealistic patient expectations, and poor soft tissue biotype, okay. So, in these cases, it will act as a risk factor if we still do it, okay, so it will have a bad prognosis as well. Coming to the contraindications of implant treatment, so radiotherapy, untreated intraoral pathology, untreated periodontal disease, uncontrollable drug or alcohol abuse, uncontrolled psychiatric disorders, um, okay, recent myocardial or cerebrovascular accident or valvular prosthesis, surgery, intravenous bisphosphonate, okay. So these are the contraindications. Immunosuppression, okay, inability to maintain high levels of plaque control. So, example in the reduced manual dexterity or mental capacity. So, in those cases, also it's contraindicated. Okay, options of treatment for tooth loss. So there can be four different things. So there can be no treatment, a denture, a bridge, okay, and an implant treatment. Okay, so there can be, we can choose from any of these treatment to restore the tooth loss to mind. Okay, coming to the prerequisites. So good quality clinical photography shows all standard views and site-specific views, two set of study cards, one untouched and one used for planning, phase one occlusal records for planning, a realistic tooth wax up or setup based on the above decision. At this point, it will be possible to see whether the definitive restoration is likely to be fixed or removable. Construction of radiographic stent based on the tooth setup above with radiograph marker. Okay, that will. So why do we use a radio opaque markers? It'll show up in the CT scan. Any sectional or full R scan, which is done by CBCT. Coming to the last prerequisite, that is analysis with suitable planning software to allow realistic 3D plan for implant and restorative component positions. Okay, so these are a straight set of prerequisites. Okay, so coming to the impression techniques. Okay, so there are two main techniques: is the open tray and closed tray technique. And yeah, so also open tray is known as direct impression technique, and the closed tray is also known as the indirect impression technique. Okay. So first we'll be reading the open tray or direct procedure. So this impression uses the direct transfer with the long retaining screw, which is included, and then it is attached. Then they attach the transfers to the implant with the hex tool. Okay, this is the hex tool. All right. So we have to use a custom tray for this, and we prepare holes all over. And definitely you need to block out holes on top of the screw with the wax or other suitable material. Okay, so here we can block it out like they did. Okay, so place light to medium body impression material around transfers and record a full arch impression with medium body. Okay, so medium body is being used. Now with the tray still in place, unscrew or remove all the retaining screws. Then remove the tray and capturing the transfer in the impression material. Okay, so this portion basically. After removing the impression tray, you have to connect the implant replica to the transfer, which are still in place in the impression material. Okay. So screw transfers the replicas together with the hex tool and hold the replica in place to prevent any rotation of the transfer. The impression can now be sent to the lab. Okay, all right. So this is how the impression is going to look, and it can be sent to the lab. All right. Okay, all right. So thank you so much for patient listening, and please refer to Mish book for implants, okay, dental implants by Mish. If there are any further questions, please you can come to my department, and you can see me in my polyclinic, and we can clarify all the doubts. Thank you.